Hello guys, welcome and welcome to Metier International Academy, one of the leading academy in training nurses and nursing competitive exam as well as IELTS and Flex and OET training. So magic pill sessions வந்து நம்ம இப்போ ரெகுலரா வந்து பார்த்துட்டு இருக்கோம். ஸோ ஏர்லி மார்னிங் நீங்க எழுந்துக்கும் போதே இந்த மேஜிக் பில் செஷன் பார்க்கும்போது உங்க ஜஸ்ட் ஒரு மோட்டிவேஷனா இருக்கும். ஒரு கொஸ்டின் பேப்பர் டிஸ்கஷன் எடுக்கும் போது ஒரு ஸ்டார்ட் அப் ஆஃப் த டே வந்து ஒரு பெட்டரா இருக்கும் அப்படின்ற ஒரு கான்செப்ட்ல இந்த பிரெயின் ஸ்டார்மிங் கொஸ்டின்ஸ் வந்து உங்களுக்கு கொடுத்துட்டு இருக்கோம். ஸோ இன்னைக்கு என்ன மேஜிக் பில்ஸ் கொஸ்டின்ஸ் அப்படின்னு பாத்தீங்க அப்படின்னா பீடியாட்ரிக்ல இருந்து எடுத்திருக்கோம். So let's start the session. So when caring for a neonate of a diabetic mother weighing 4.5 kg who was delivered vaginally, the nurse would assess the neonate for the fracture of which of the following. So நான் ஒரு சிங்கிள் ரீடிங் தான் பண்ணியிருக்கேன். இந்த ரீடிங்ல நான் என்னென்ன கீ பாயிண்ட் நான் எடுத்திருக்கேன் அப்படி பாத்தீங்க அப்படின்னா ஃபர்ஸ்ட் கீ பாயிண்ட் வந்து நியோனேட் ஆஃப் த diabetic mother. So mother is a diabetic. Okay. So அவங்களுக்கு she has given a birth to a baby with the weight of 4.5 kg. So அவங்க ஒரு பேபி வந்து டெலிவரி பண்ணிருக்காங்க. ஸோ அவங்களுக்கு பேபிக்கு என்ன வெயிட் அப்படின்னு பாத்தீங்க அப்படின்னா 4.5 kg. So the nurse would assess the neonate for fracture of which of the following. So the nurse வந்து என்ன எக்ஸ்பெக்ட் பண்றாங்க, there is a fracture. So எந்த ஏரியால எந்த இடத்துல fracture இருக்கு, எந்த பாடி பார்ட்ல fracture இருக்கிறதுக்கு வாய்ப்பு இருக்கு for a diabetic mother ஓட பேபிக்கு அப்படின்னு சொல்லிட்டு கேட்டிருக்காங்க. Fine. So you should know the concept of what will happen to the baby of the diabetic mother. The first one, what you're supposed to remember is macrosomic baby. The baby weight will be heavy, that is 4.5 kg. Usually for a mother who delivered the baby, the Indian baby weight is, the normal weight is 2.5 to 3 kg or 3.5 kg. Okay. So less than 2.5 kg, அதை வந்து நம்ம என்ன சொல்லுவோம் அப்படின்னா low birth weight அப்படின்னு சொல்லிட்டு மென்ஷன் பண்ணுவோம். Fine. So இங்க வந்து diabetic motherனால usually the complication is macrosomic baby. So அவங்க பேபி டெலிவரி பண்ணும்போது what is the complication? Shoulder dystocia அப்படின்னு சொல்லிட்டு சொல்லுவாங்க. So once the baby undergoes shoulder dystocia, so that time there is a chance for fracture. So which area fracture? Okay, so that is what we are going to see now. So here let's see the options. So clavicle, skull, wrist and rib cage. So four options they have given here, and the right answer here is clavicle. What is the right answer? Clavicle is the right answer. So why I selected the answer as a clavicle? The rationale behind this is the macrosomia. The macrosomia already said that it is a complication of the diabetic mother. Okay. So once she given the birth to the baby will be having macrosomia. That is, the weight of the baby is going to be more. So here also I have said the same thing. The macrosomia or large for fetal size may result in birth trauma. So what kind of birth trauma? Fracture will be there. So which area most commonly the fracture will be there? Because of shoulder dystocia, there is a fracture of clavicle. There is a chances of fracture of what? Clavicle. Understand, guys? So that is the reason why we selected option A. Okay. And other fractures which is very common in the breech presentation is fracture of the humerus and fracture of the femur. That is mentioned in the second golden point. Fracture of the humerus and fracture of the femur may occur in the breech delivery with the extended arms and legs. If there is a extended arms and legs with breech delivery, that time there is a chance for fracture of humerus and femur. And the last one is, if there is a forceps delivery, if the doctor is conducting the forceps delivery, that time there is a chance for what? Skull fracture. What kind of skull fracture? Linear fracture. What is the meaning of linear fracture? A light hair-like fracture will be there in the skull. Okay, so that is called as what? Linear fracture. So these are all the golden points. So according to this question, for a diabetic mother, the complication is macrosomic baby. And because of the macrosomic baby, while delivering the baby, there is a chance for getting shoulder dystocia. During shoulder dystocia, there is a chance for getting fracture. Which area fracture? Clavicle fracture. So this is how you have to make a chain of each and everything. Understand, guys? For your better understanding, I have given, see, this is everything, whatever the question, whatever we are discussing, you know, all the questions are taken from previous year question papers only. Okay, fine. So here for your better understanding, I have added some more golden points. What is shoulder dystocia? Many students don't know what is shoulder dystocia, right? So here I have given the definition. When fetal head is delivered, the shoulder are stuck and cannot be delivered. It is known as what? Shoulder dystocia. The fetus oda head வந்து deliver ஆயிடுச்சு, ஆனா shoulder வந்து delivery ஆகல. So அதுதான் என்னது? Shoulder dystocia. So that time there is a chance for what? Fracture of the clavicle. Okay, guys. And one more thing I have said that linear fracture. So here I have shown different type of fracture. You can see this is the baby where the skull is delivered easily, whereas the shoulder is packed in the mother's womb. Okay, the outlet is the shoulder is stuck in the outlet of the mother. Okay, so that's why there is a chance for what? Clavicle fracture. Okay, fine. On the other hand, one of the option there they have mentioned like skull fracture, right? So there are different types of fracture, guys, especially in the skull. You can see here linear fracture, depressed fracture, diastatic fracture, and basilar fracture. You should know the definition of these things. Linear fracture means a mild hairline fracture which is commonly seen in the forceps delivery. Second one is depressed fracture. Small depressions will be there in the skull. Okay. And the next one is diastatic fracture. The third one, diastatic fracture. What is diastatic fracture? In the diastatic fracture, you know the suture lines, right? So you can see the suture lines here, right? Fine. So in the suture line or along with the suture line, the fracture will travel. And the suture line irukka edathile and the fracture வந்து அப்படியே travel பண்ணும் சரிங்களா. So the last one is basilar fracture. At the base of the skull, the fracture is present. Okay, guys, fine. So these are all the different types of fracture. So hope in the question la shoulder dystocia அப்படினா என்ன, macrosomic baby அப்படினா என்ன, so diabetic mother க்கு macrosomic baby இருந்துச்சு அப்படினா அவங்களுக்கு என்ன காம்ப்ளிகேஷன் வரும், shoulder dystocia, அதாவது அந்த பேபிக்கு shoulder dystocia வர chances இருக்கு. So clavicle fracture வரதுக்கான வாய்ப்புகள் அதிகம். Okay, so this is what you should supposed to understand in the first question. So let's go to the second question. Hope everyone understand the first one. See, the next question is which muscle injury causes torticollis during the delivery? So first you should know what is torticollis. Okay, we will be discussing about the torticollis. See here, these are all the options they have given for this question. Skeletal muscles, sternocleidomastoid muscles, smooth muscle, and cardiac muscles. 4 options they have given here. Among this, the right answer is what? Any guessings? Fine. So here the right answer is option B, that is sternocleidomastoid muscles. So the rationale behind this is torticollis. It is also called as wry neck or twisted neck. In the exam, in the question paper, they sometimes instead of torticollis, they can also mention wry neck or twisted neck. So that time you're supposed to answer the question correctly. Okay. So torticollis is also called as what? Wry neck or twisted neck. It is a condition that causes the neck muscles to involuntarily contract. I have given the image also. You can see, consider this as a right side. And this one is the left side. In the image also, it is mentioned right and left. Okay. So here you can see in this area, the tightening of the right sternocleidomastoid muscle is present. Here, you can see here, the tightening of the right side sternocleidomastoid muscle is present. Because of the tightening of the right side of the sternocleidomastoid muscles, the head is twisting or turning toward the left side. Okay. So this condition is called as what? Torticollis, right-sided torticollis. Because right side sternocleidomastoid muscle is contracted right. So that's why it is called as what? Right-sided torticollis. Understand, guys? So which muscle is involved here? According to the question, sternocleidomastoid muscles are involved here. That's why we selected option B. Okay, guys? Fine. So this is asked in RRB nursing officer exams. And the next question is, a preterm neonate admitted to the NICU as muscle twisting, seizure, cyanosis, abnormal respiration, and short cry. So these are all the options they have given here: brachial plexy, dislocated hip, intracranial hemorrhage, and fractured hip. In the question, the keywords are the signs and symptoms like muscle twisting, seizure, cyanosis, abnormal respiration, and short and shrill cry. What will happen in the brachial palsy? I have given the image for your better understanding, because brachial palsy, also called as upper trunk injury, and two types of palsies are very, very common, guys: Erb's palsy and complex palsy. So here the image is given. You can see the Erb's palsy and complex palsy. Erb's palsy, it is also called as what? Brachial palsy. The brachial palsy word is mentioned in the option. So whenever you are getting the word brachial palsy or Erb's palsy, immediately you have to think about what? Upper trunk injury. What trunk injury? Upper trunk injury. Suppose if you are getting the word complex palsy, lower trunk injury. Fine. So these are all the 2 key points you're supposed to remember. Upper trunk injury, lower trunk injury. Upper trunk injury means brachial plexy or Erb's palsy. Lower trunk injury means complex palsy. So in Erb's palsy, what are all the nerve roots are involved? The nerve roots like C5 and C6 are involved. It is also mentioned in this image. Whereas in Kuplik's palsy, C8 and T1 is involved. That is also mentioned here. See, all these points are very, very important for your exams, guys. All the points are golden points. Okay, fine. The next important vital point is in Erb's palsy, waiter tip posture is present. See the hand, it is like waiters is getting the tip, right? Means after the delivery of the food, the waiter used to ask for the tips. Okay, so that time otherwise policeman tip. Okay, so waiter tip posture is present in the Erb's palsy. Okay, fine. Whereas claw hand deformity is present in the Klomsky palsy. Fine. So you should know the difference between the Erb's palsy and complex palsy. Erb's palsy, upper trunk injury will be present. Waiter tip posture will be present. Complex palsy, lower trunk injury, that is claw hand deformity will be present. And which nerve root is involved? These are all the very, very important golden points. That's why I have given the brief explanation about the brachial palsy. Okay. The next, all other options are very simple, like dislocated hip, intracranial hemorrhage, and fractured rib. So for this question, the muscle twisting. So muscle twisting, brachial palsy, chances are there, but seizure, cyanosis, abnormal respiration, these things will not be there in the brachial palsy. Even in the dislocated hip, fractured hip, these options is not at all suiting, right? So which is the best option here? Intracranial hemorrhage. In intracranial hemorrhage, there is a chance for what? Muscle twisting, seizure, cyanosis, abnormal respiration, and short and shrill cry. Okay, so that's why we selected what? Option C. Fine, guys. This question asked in AIIMS Partner Nursing Officer exams. The next brainstorming question is, a newborn has a small whitish pinpoint spot over the nose. This is the key point in this question, guys. Very, very important one. Small whitish pinpoint spot over the nose, which the nurse knows are caused by the retained sebaceous secretion. This is the second key point, sebaceous secretion. When charting this observation, the nurse identify it as. For your understanding, I have given the image. Image-based questions are very, very common nowadays. If you are getting the image-based questions with this kind of images, immediately you have to go for 4 options are given here. Whitehead, Mongolian spot, Melia, Lanugo. Among these, the right answer is option C, Melia. So why we selected Melia with the 2 key points which is given in the question. The first key point is small whitish pinpoint spot over the nose, whitish pinpoint spot. Second one is sebaceous secretions. The sebaceous secretion is the one which is used to keep our skin oily. Okay, oily skin because of what? Sebaceous gland. Understand? So this sebaceous gland for the newborn, it looks like the secretions or looks like what? Small white heads or whitish pinpoints. That's why we selected option C, Melia. Okay. For your better understanding, I have given the meaning also. Melia is a multiple tiny rise to white and yellow spots. Even we can say it as a cyst on the nose and face due to the retention of the sebum in sebaceous gland. What will happen for us? The sebaceous gland will secrete the oily sebum. It will spread over our face. Whereas for the newborns, it is going to stagnate or retain in a particular place. That's why it is giving a white pinpoint spot appearance. Okay, you can see very clearly in this image, white pinpoint spot appearance all over the face because of the retention of the sebum. Okay, fine. And this disappear within first 4 weeks of delivery after the delivery. Okay. So this question asked in ESI. The next one is a very simple question. From the image itself, easily we can understand what they are asking. The parent of the newborn questioned the nurse regarding the blue-black discoloration in the sacral area of their infant. The nurse explained these area are Mongolian spots. So the parents are asking a question that is blue-black discoloration in the sacral area, and the nurse also explained this is the Mongolian spot. So what is Mongolian spot? This is the question. So here you can see they have given 4 options, that is indicate a birth defect will disappear in about a year, or something like a birthmark indicative of a internal problem. So among these 4, which is the right answer? You can see in this image-based questions, iliosacral region and gluteal region. These kind of birthmarks are very, very common, and the color will be blue to black. Okay, blue black discoloration. So if this kind of discoloration is present, it is called as what? Mongolian spot. But here in this question, when it will disappear? It will disappear in about a year. That is, within a year, this Mongolian spot or bluish black discoloration will disappear. Okay, so Mongolian blue spot, it is also called as birthmark. It is a bluish black pigmented area mainly in the lumbosacral region and lower back, and it is disappear within 6 months to 1 year. Okay, guys. So all the key points are given here. Fine. Okay, guys. Thank you. Hope all the questions are very interesting, and all the questions whatever we discussed, already asked in the examination. So the golden points we discussed, the key points in each and every questions we discussed about the rational. So all the points whatever we discussed are very, very important. So go through again and again. Okay, whenever you are getting the free time, go through again and again, so that the revision is very, very mandatory before the examination. Image based question, obviously nowadays it is very, very important. So revise the questions whatever we are displaying in the YouTube channel, and all the best for your upcoming examination. So let's meet in the next magic pill session. Thank you, guys.